Hi everyone, we're here at Conneaut Lake Veterinary Hospital, and today we're doing something a little bit different. Although we did do one of our seminars up at the Bark Park on cats and cat health, today we're down here because we're going to talk about Max. And how old is Max? Introduce Max to us. By God, he's gorgeous.
Yeah, so this is Max. He's our clinic cat, I guess you could say. One of our clients brought him in as a stray a few years ago. And he was all matted, and he had an oral mass. And so we biopsied it, and it actually came back as benign. So we were able to get rid of it, got him all cleaned up. We had him here for a few months, and we weren't able to find a home for him. And so now he hangs out here. He has his own run in the back with his big fluffy bed, and he's just living the dream. He's an older fella, so he's got some arthritis. You can see his eyes are a little squinted because he has some, his eyelids are rolled in a little bit.
He's purring right now.
Yeah, he has a wonderful personality. He just recently got his teeth all cleaned up because he had a lot of dental disease, and so we're just kind of, slowly getting them all fixed up. And
he's very, very pretty.
He's very sweet.
Well, let's talk about cats. Since I have, and we're going to talk about this, I will not let you out of here today unless we talk about barn cats, because I have the barn cats.
Oh, I know.
But let's talk about cats, and let's talk about what tests we should do on them.
So whenever we get a new cat in,
and how soon?
Okay.
Kittens or right away or whatever?
Yeah.
Oh, okay.
So whenever we get a new cat in, whether it's a kitten or just a stray, we always recommend what's called a feline leukemia and FIV test. So this is a test that we perform in-house. It's a blood test, just a few drops of blood, and it's looking for those two diseases, feline leukemia and feline immunodeficiency virus. So that's the equivalent of cat HIV, basically.
Okay.
That's why it's FIV. And then leukemia, again, is similar to leukemia in humans. They're both viral diseases that they can get. They're very, they can be very contagious to other cats, and they usually end up being fatal at one point or another, whether it's because they get a secondary infection or cancer develops as a result of those viruses.
Do they? Is that transferred from the mother cat?
It can be.
Okay, so sometimes that happens.
Yeah, it can also be like through saliva. Or sexual contact, things like that.
But if I have cats, and they're outside cats, of course, but they can get this? Is it airborne or what?
No, it's carried within the cat, and it's supposed to like a bite wound or saliva, or blood, that type of thing. But the idea is if you're bringing a new cat into your home and you already have a cat that's negative, we want to make sure that the new cat is also negative so that you don't have a new cat that has one of those diseases, and which could also give it to your previous cat.
How old should a cat be before you do those tests?
We can do it whenever, at any age.
Like a little kitten?
Yeah. So part of like the kitten's first exam, if they haven't had that test, is usually doing.
When should that be done?
At their first visit.
And when is that usually? Little time?
They should be about 8 weeks when they go away from their mom.
Okay, and then that's whenever people should be considering about having those tests done.
Right. But if it's an adult cat that has been a stray for 6 years,
and came to visit all of a sudden.
It's been sticking around. You would decide to adopt it. It's also a good time to do it then to make sure that they don't have it.
Okay, so if they have it, is it treatable?
It is not treatable. There are some antivirals out there, but they're very, very expensive, and their efficacy isn't really well studied. So it used to be, when we had a positive test, like years and years ago, that we would often recommend euthanasia because we know they're going to get cancer or something at some point from this. Now, it's very dependent on the situation, but in the appropriate household, if there's not other cats or other cats already have the disease, whatever, they can lead up to a point a normal life. We have to be extra careful that they don't get infections from other things. So It can't be an indoor-outdoor cat, you know, because if they got a bite wound or a scratch or something, it could be much more serious.
Could they live a long time?
Spreading it. They can, but they are very prone to cancer, and so we tend to see them get a cancer at one point or another.
And no medication or anything like that?
Not really.
Huh. So that's tested. Now, so I bring my kitten in, and I've certainly had enough cats put in here, and I want to do the FIV and the feline, FIV and feline leukemia. That's two different ones.
It's two diseases, but one test.
Okay, what other tests should I do?
A fecal exam. The stray cats, the outdoor cats, tend to have worms of one variety or another. So we like to find out what those are so we can treat those.
Okay, dumb question. I'm a good person here because I have cats, but I don't know a lot about them. What about, how do I get that fecal? Out of the litter box?
Yep.
You can actually take it out of the litter box?
Just pick it right out.
Oh, really?
Now, the key is to make sure you get feces because with the clumping litters, sometimes a urine clump can look a little suspicious to a portion of feces, but we have to make sure it's feces.
Okay, so I can actually I always thought to myself, how was I ever going to get a cat's poop sample? And now you can do
Just
it by...
take it right out of the litter box.
all right.
Yep.
So, and what do we find out if we do that? Worms and stuff like that?
Right. And so we can find out what type of worm it is and then pick an appropriate dewormer to clear up that infection.
Okay. What else? What other tests am I going to do if I bring my cat in?
So for a younger cat, that's kind of the extent of it at that point. Unless they're getting spayed or neutered at the same time, at which point we would recommend some basic blood work. But for a younger cat, that's kind of the extent of it. Just like our geriatric dogs and our geriatric cats, we recommend blood work. Once to twice a year, just to keep an eye on the liver, kidneys, and internal function, things like that. But for the well cat, that's kind of the extent of the testing that we recommend.
Okay, so to protect my cat, what other things should I do once I have this cat?
Okay. So vaccinations,
What vaccinations?
just like in dogs, are important. And so the core vaccines are the ones that we recommend that all cats have, regardless of their lifestyle, is the rabies vaccine.
That's required by law for cats?
It's not required by law in the state of Pennsylvania.
For dogs?
For cats.
But for dogs
it is. For dogs.
But not for cats.
But some people say, well, it's not required by law because I'm not going to do it. And I always say, that's true, but rabies is zoonotic, which means your cat could give it to you and it's not curable. And so if you or your child got it, that's it.
Can a cat pass rabies to a dog?
Yes.
Really? Okay.
A cat could pass rabies to a dog, a cow, a beaver,
really?
a human, a child, an elderly parent, and it's fatal. So I always strongly recommend vaccinating for it.
Okay, so we're going to vaccinate against rabies. What else are we going to
The
vaccinate
other
for?
core vaccine is...
I like this cat.
Isn't he wonderful?
Yes, he's purring himself to death. But the way he's looking at my hand, do you think he's just kind of checking my hand out, or do you think he's getting rabies?
Well, I think he wants you to get the sweet spot back here.
Oh, where's the sweet spot back here?
I don't know. I'm just giving you a hard time.
I don't know anything about it. Okay, keep going.
So the other core vaccine that we recommend is abbreviated FVRCP, which is feline viral rhinotracheitis, panleukopenia, and calicivirus. So those are viral diseases that cats can get.
One dose?
Well, it's a series,
Oh, a
just
series.
like in dogs. So we like them to have if it's their first time being vaccinated, we want them to have 2 doses of it after they're 12 weeks old. So if you bring your cat to me and it's 8 weeks old, it'll get one then, one at 12 weeks, and then another one. But those are viral diseases that cats get. It's all viruses: a herpes virus, a calicivirus, and a parvovirus, and they cause upper respiratory disease, eye problems, issues in the GI tract or with like the white blood cell counts, all sorts of bad stuff. They used to be much more prevalent, but because of vaccination, we don't see them as much anymore. But it's something that all cats should be vaccinated for, regardless of their lifestyle.
Well, now here's my issue, and we've discussed this. I have cats, I have barn cats, but just like I can't always catch them to get them spayed or neutered, if I bring them in, and people would probably laugh at this, but sometimes I bring them in a trap because I just a live trap because I happen to get them that way. I can't get them a second time, and that's always an issue with me.
Yeah.
You always say to me, well, you need to bring the cat back for another vaccination. I say, it could be in 6 months. It could be maybe not for a year till I catch him again.
Yeah.
So what should I do if I can't do that? He's going to have rabies. You're going to do that the first time in. We're going to do the rabies.
And that's a one and done, which is of all the vaccines, that's the most important one.
Okay, so I should really do that one.
Because it's with respect to the cat's health, but it's also human health, which is, that's one of the biggest things that we do as public health with these infectious diseases that can go from animal to people. Human health is paramount. We want to, keep the cat healthy too, but the owner is more important, essentially.
So I need to at least do the rabies.
Yeah.
And then I certainly, with my dogs, and if I could with the cats, if I could catch them, I have 2 that I can catch, so they have all the things that they need. But the other ones that are like fly-by-nights, when am I going to get them? It would be forever to try and catch them.
Yeah.
What's the importance of spayed and neutering these guys?
Well, it's important. There's 2 more vaccines I want to talk about.
2 more vaccines.
So the core vaccines we talked about, if it's an indoor-only cat, that's really all they need. They can certainly have these other ones, but it's not really essential. Outdoor cats should also be vaccinated for feline leukemia because they're going to be exposed to it.
And that's 2 doses or whatever.
Yeah, and then there's the 4th vaccine is the FIV vaccine, and that's a little controversial. It's effective, but the caveat is the test that we use to detect FIV, it will be positive if the cat is vaccinated for it. So if we vaccinate for it, they'll be protected, but if they ever have a mysterious illness, we lose one of our good tests as an option for a diagnostic. So we kind of have to weigh the cost and the benefit to determine if we should vaccinate or if we should not. I would say most people end up just vaccinating if it's a truly outdoor cat or indoor-outdoor. They say, I'd rather just have the protection.
Is that once a year?
Yeah.
You always make me feel guilty because I'd like to vaccinate.
Don't feel guilty.
Well, I'd like to vaccinate mine, but then again, I drive past places and I see 15 cats running loose. And people aren't doing anything probably for them because they were born and they're probably feral. Feral meaning?
They're
just there.
Yeah, they're wild. They're not used to human cohabitation.
Can a feral cat live a long life?
Yeah. It's just like any wild animal versus a captive one. I do a lot with Tamarack wildlife. If you look at like a wild red-tailed hawk, we're talking like 5-10 years. In captivity, 30 years, no problem. So it's the same thing.
Is he going to get down?
No, he'll probably stay up here.
Oh.
Unless you let him jump down.
Oh. Well, do I want to keep him from jumping down?
Yeah.
Why?
Because he's the star of the show.
Oh, but I mean, okay, well, he's a star.
A wild cat's just going to be more prone to disease because they're out in the wild, more likely to get in fights. There's predators out there, so on and so forth. So the risk is just higher.
Okay, what else should I do? Oh, how about flea medicine?
Yeah, absolutely. Regular flea...
Were we done with the vaccines?
We're done with the vaccines.
Okay, let's go to flea medicine.
So flea and tick prevention is huge. In our area, we don't have as many, or I don't see it as frequently, of disease transmitted by ticks. There are some that cats can get, but in our geographic area, we tend to see more tick-borne disease in dogs. That's not to say that cats can't get it, and we certainly don't want them to have ticks because it is still taking a blood meal, and they could pass on a disease. So flea and tick prevention is good. Fleas, as we know, is part of the life cycle of the tapeworm. So by preventing fleas, you're also preventing tapeworm infection.
Is it the same thing as a dog, once a month?
Yep, once a month.
Is it the same thing, drops down the back? Or?
There are different options. So there's drops down the back, and then we have like the Seresto collars for cats too, which a lot of people like for their outdoor cats that maybe they can't catch every month, so they put that on. It's good for 6 to 8 months, and they have longer protection.
Oh, okay.
There is heartworm prevention for cats as well. Cats have somewhat of a natural immunity to heartworm, so we don't tend to see as large of heartworm infection in cats, meaning a dog might have, dozens and dozens and dozens of worms in their heart and arteries. A cat, we might see like 6 worms, but it still can cause disease. Not all of them can fight it off, and so it's still worth preventing against.
Okay,
possible.
what about ear mites?
So ear mites we tend to see in, stray feral cats. And one of the topical flea preventatives that we use, the Advantage Multi, also takes care of ear mites.
What about that other collar?
The collar, it does not do the ear mites.
Of course not.
Yeah.
But now, what are some signs that that cat is shedding?
He's got a long,
oh
long
my Lord. It's almost like being around my collie. You have to like dog hair, you have to like cat hair here. What about ear mites? Is that something? What are some signs of it?
So usually shaking the head, scratching at the ears, and like a really dark, almost like coffee ground looking discharge from the ears. And then what we do here to diagnose it is we take some of that nasty discharge, we put it on a slide, look at it under the microscope, and we can actually see the mites. And there's characteristics of the mites that we look for to say that it is an actual ear mite.
Okay, what about the, one of my cats has draining eyes. What is that? And they sneeze all the time.
Yeah, so that's probably one of those viruses that we vaccinate for. So like the herpes virus or calicivirus. That's the most common.
He can live with that?
They can live with it, but it tends to be that they have reoccurring upper respiratory tract infections, which is the sneezing, the watery eyes, and so on. There are some things we can do to kind of help with the reoccurrence or the frequency of the flare-ups. But it's just like herpes virus in people, like the cold sore herpes virus. Once you have it, it just kind of hangs out in your system. When you're stressed, it flares up. Cats are the same way. That herpes virus is hanging out in their system. Something stressful happens, like somebody new moves into the house or the Christmas tree comes out, whatever. They get worked up about it for one reason, and they start sneezing and coughing and have discharge.
Can they transfer that from one cat to another? Can they?
Yeah. So that's why vaccinating is important, especially if we know that it's in a colony of cats, to prevent the spread of it to the other cats.
What about when the cat's fur gets real thin? What is that?
It can mean a lot of different things. It's often, either skin related, like an allergy or fleas or something, more superficial like that, or it could suggest something internally is going on.
Okay, so if somebody doesn't want to get all these things done, the very, very least they should get done is the rabies.
The rabies and the FVRCP vaccine.
The very first time. Oh no, that's every year too.
That it's yeah.
So every year they should get that.
Yeah.
And that's the one that's given in 2 doses, 3.
It depends on when the cat first comes in.
And then if you miss one, these are my usual problems.
Yeah.
You give the thing, and then you say, well, you've got to give another one inside of.
Yeah, we know that to get the immune system's like maximum effect, that we have this like 3 to 4 week window where we need to booster it, and so that's kind of the reason behind the timing there.
And if I miss that, then I have to start over again.
Yeah, then we have to start over.
Oh wow.
Yeah.
Is there an easy way to catch a cat?
Not a feral one.
No.
With respect to people's house cats, we get a lot of complaints about trying to get the cat in the carrier, things like that. We have some information at our seminar that we talked about, so you can see that episode. I think we have some on our website about how to train a cat to go in a carrier. And then a service that we offer here is that we'll do house calls too. And a good portion of the house calls that I do are often, cat house calls, because it's so much easier for me to come into the house, look at the cat, on its favorite chair, and give a vaccine there, versus the owner, trying to get the cat, shove it in the carrier without getting bit or scratched. So that's a service that I think people appreciate. It's less stress for them, it's less stress for the cat, and everybody's a lot happier.
You don't want to come to the barn and live for a week. and have the cats love you. Now,
I could bring my hiking gear and set up.
I can get them because I'm feeding them. It seems that whenever you feed a cat, they love you.
Yeah.
If they're 10 feet away from the table where I feed them, they don't want anything to do with me. But if I'm up there feeding them, suddenly then I've got all 4 of them. The 5th one never comes around. But I can grab them, and then I have to put them into a carrier to get them here.
Yeah.
So that's always kind of an interesting little chore too.
You mentioned spaying and neutering.
Yes.
Essentially similar to that of a dog or a cat, like 4 to 6 months. We don't have, like giant breed cats, so we don't have to worry about, that aspect of it. We talked about in the larger giant breed dogs sometimes will wait a little bit longer as their bones are growing, but we don't have to worry about that as much in cats.
What about a lot of people, because it's convenient, there are different organizations out there where you can go and you can get a cat spayed or neutered. Do they usually spay them that way, or they neuter them, or both?
It depends on the gender.
Oh, okay. So sometimes there's places that do mass spading of cats and mass neutering of cats.
Yeah, it's usually like a spay and neuter clinic type of thing.
There are some places around here that do that, and I think not that they're trying to avoid, it's usually a feral cat or an outside cat.
Right.
And it's just somebody that needs to get it done and goes to a place like that to get it done, which is better than not doing it at all.
Right, yeah. If we're going to have, if we're going to be feeding outdoor cats and having, larger quantities of cats coming together, they really should be spayed or neutered depending on their gender to prevent, the population from just increasing. Because if you're getting more cats together, they're going to breed, and then there's going to be more cats. That spreads more disease, and it's just a vicious cycle.
Why did you talk me into, I spayed the cats because I didn't want kittens, but you told me that I should neuter a cat.
A male one?
A male one.
Well,
why?
Females get spayed and males get neutered.
Right, so why did I want to neuter a male cat that is an outdoor cat?
So it can't reproduce.
But if I had all my cats were spayed, then who could he reproduce to?
Well,
if there's another one in the area.
Yeah, so think about the male cat tends to do a lot more roaming. So he may not be mating with the females at your barn, but he could be mating with the females at the barn down the road.
What about when you're howling at night? What is that?
That's often the females in heat.
And they just go crazy. It sounds like they're fighting.
Do
they
sometimes? Or they could be fighting. They could be fighting too.
Will male cats destroy or kill kittens sometimes? Or is that a fallacy?
I don't know. It kind of depends on the situation.
I mean, I'm talking about barn cats here, because they're. But most people probably that watch a lot of these videos probably do have predominantly outside cats.
Yeah, I think most of the time the male cat is gone by the time the kittens happen, but I'm sure there is some infanticide that happens here and there.
What about cat bites? What about if they bite a human? What should I do?
Yeah, so
because they always think that's going to happen.
Right. So it's very important. We know that cats are a big rabies vector species, so that's a red flag right there. So if the cat is current on its rabies vaccine, nothing we have to worry about. If the cat's not current on its rabies vaccine, but has had it before, it needs to get it boosted and then needs to be supervised. If it hasn't had a rabies vaccine before, it either needs to be quarantined and supervised for a given period of time, or if there's any suspicions of rabies, it needs to be euthanized and tested for rabies.
What about when they bite me?
Now for you, you need to clean that wound out right away, warm water and soap. Even if the rabies isn't a factor, cats have some nasty bacteria that can cause you to get an infection or abscess. And then I would contact your physician and say, hey, look, I got bit by a cat. They're going to want to know about the cat's rabies vaccine status and so on. They may let the public health authorities know, which is standard for any animal bite. And then, they may have you monitor it, watch for discharge, antibiotics, things like that.
What about, I remember you said this at one of our seminars, and I immediately went to a local place and bought another kitty litter. How many litter boxes do I need for cats?
So 2 litter boxes for the first cat, and then 1 extra litter box for each cat.
For every cat beyond that. What about the cats who go primarily in 1 litter box and not so much in the other 3 or 4?
Yeah, that's
Why?
their favorite spot.
No big thing. I mean,
if you think about like dogs, some dogs have a favorite spot that they like to go, a particular area of the yard, or a section of the woods, whatever it may be. And cats are the same way. They can develop a preference for a specific litter box.
Anything particular on cat food for the people that have them in their homes? Any cat food works?
Yeah, any of the commercial cat foods is fine. It's important to make sure you are feeding cat food because they're a true carnivore, meaning they require more protein and fat than like a dog, which is not a true carnivore. Dogs don't need a ton of meat, so on and so forth.
These guys do.
These guys do. And so if you look at the protein content of a cat food compared to a dog food, it's much higher. And so, years and years ago, we used to see a lot of heart disease in cats because there wasn't enough of certain type of protein in the cat food. That's been adjusted now, and we don't see it much anymore, but that's why you can't feed like a dog food to a cat because it's lacking some proteins and nutrients, and they can develop some heart disease, blindness, things like that as a result of it.
What about hairballs?
So there are like hairball foods. Regular brushing by the owner is a huge thing, especially like in a long-haired cat like this.
There's cat hair everywhere
so
right
Max
now.
gets a lot of brushing. That's going to eliminate a lot of it because there's not so much there for them to lick off and ingest. The hairball diets I mentioned, there are like some like little additives that you can give to kind of help things keep moving through.
This cat loves attention.
Yes, he does.
Huh. What else? Let's see, hairballs, there was something else I was going to ask you about. We talked about the litter boxes. What about giving them a pill? That's always my classic. I come down here, I get the cat spayed. You say, well, you've got to give them pills or whatever. What's always my response? Forget that, that's not going to happen. Why are they so hard to give pills to?
I think it's just a smaller space and sharper teeth.
Sharper teeth.
Yeah.
That's the big thing.
And cats aren't always as easygoing as dogs and don't like it. So, the first thing I always try is, can we avoid pilling to begin with like a pill pocket or something, which is a treat that has a little hole in it. It's kind of a malleable substance, so you can put the little pill in there, close it up, and they just take it like a treat. Max here loves pill pockets.
Really?
And so that's no stress for anybody. All you have to do is put the pill in, give him a treat, and everybody's happy.
Now, do you put the pill pocket in his mouth, or do you put it in his dish and let him take it when he wants it?
Put it in front of it. He gets excited about it.
He gets it right away.
He sees the bag and he starts dancing around and pawing at it like he wants it. So you just set it in front of him.
So pill pockets work for cats, and you can get those at a lot of places.
Yeah. I know we have them here. Other places I'm sure have them too. So that's one option. That's probably the ideal way.
All right.
There are some medications, depending on the disease and the medication that we need, there are some long-acting injectables that we can give. Like we have one antibiotic that can do that. So if the disease process warrants that specific antibiotic, that's an option that we have. Sometimes we can try and do liquids versus a pill. And so instead of having to get your finger in the mouth, you can just lift up the gum and put a few drops of liquid in at a time versus having to get a pill in there. So that's an option.
You're making me laugh. I have such a difficult time. I could do almost anything to a dog, but boy, cats are tough.
And then for pilling, I
have a pill thing.
In the pill popper.
Right.
Yeah. So in our seminar, we had some good images and things on there. He's laying down now, but. What I do, whether I'm using the finger or the pill gun, is I try and grab both sides of the jaw like that. And if I do that and lift up his head, see how his mouth popped open already?
It never works that easy for me.
I have lots of practice.
I'm sure.
But can you see how his mouth is
I
open
do.
a little bit? And then you can just, pull down and drop the pill in and push it back. But that's the least preferred because I'm still having to, handle him a lot. I'm still having to put my finger in his mouth.
Right.
And so on and so forth. So pill pockets first, or some type of alternate medication if we can get away with a liquid or long-acting injectable. And then if that doesn't work, the technicians are always happy to train people on how to safely pill because we'd rather have you do it correctly and lessen the chances of a bite or something than get home and you're tore up, the cat's unhappy and it's under the bed now and you definitely can't get the medication.
Forget that.
You know what I mean.
Okay, so I have a cat, and I want to know whether or not I should declaw that cat. Who should declaw? Which one should be declawed? Should you always declaw, and is it painful for the cat?
Yeah, so this is a big controversy, of course. Some people won't declaw at all. They just say it's inhumane and won't do it.
There's a lot of talk about doing all kind of inhumane things to animals.
Yeah.
We're getting away a lot from that.
So I always, the first thing is understanding what declawing is. It's not removal of the claw, it's amputation of a portion of the digit, the toe. And so if I were to get declawed, I wouldn't just be taking off my nail, I would be taking off this entire section of my finger.
Okay.
Okay, so from the last knuckle
And that's
to
what
the
you
tip.
do when you declaw.
That's what a declaw is. So first, I always like people to know that, because some people just think we're like taking the nail out, and for some reason, some people rationalize that as being less severe.
Okay.
And when you say it's actually a partial amputation, they're like, oh, well, forget it then. So I always like to explain exactly what it is. That's very important. And then the next situation is, or question is, well, like, why do we need to declaw? Is it because, you know, the cat's scratching up a corner of the couch? If that's the case, let's just do some behavioral modification. Put a piece of carpet on the corner of the couch. Get them a scratching post. You know, just
Does that work?
Yeah.
Okay.
Many, many times it does work. So if that's the concern, I always try to push that first, because
Behavior.
If we can just tweak something in the environment, that's much better for everybody. It's better for the cat that doesn't have to go to a surgery. It's better for your pocketbook because you're not paying for a surgery. It's less stress on everybody, and I think it's just better medicine to go that route. Now, the times where I think declawing is important is similar to the rabies. It's when human health is at risk.
Okay.
So let's say an elderly person, thin skin, more prone to infection, a young child in the home, that, you know, the cat's very good with, but just like cats when they're playing, even if they're not being aggressive, they can still, you know, get a little pinprick or a scratch or something. And that's a situation where after we've explained what a declaw is, maybe we've tried some of the behavioral modification types of things, and some people say, okay, now
That's basically, we're talking about indoor cats now. Right?
Yeah.
Okay.
Outdoor cats need to have their claws.
All of them? So a lot of people declaw the front but not the back.
I think they should have all of them, so
really?
they can still fight with their back feet, but they're seriously limited. That's a whole other can of worms, because then you have to talk about wildlife and cats killing birds and whatnot, but we won't go there.
Okay, well, let me ask you another question. Oh, go ahead, I'm sorry.
So we've made the decision to declaw now. How should it be done? This is very important. If we're going to declaw, it needs to be done right and with best medicine. So here we use a surgical laser versus a scalpel blade. And this makes all the difference in the world. This is the laser back here, actually, since we're in the surgery suite. And what it does is it cauterizes as it cuts.
Okay.
So if we were using a scalpel blade, we would make our incision and everything would start bleeding right away. With the laser, we make the incision and there's no bleeding. When blood comes in, that brings in white blood cells, stimulates inflammation, and inflammation leads to pain. So it's more painful, there's more inflammation, it takes longer to heal.
With a scalpel?
With a scalpel.
Okay.
With this, because there's less bleeding, there's less inflammation, there's less pain, there's faster healing. So that is essential to doing declaws. I've never done a declaw with a scalpel blade. I've been fortunate to only have to do it with this machine. But if you ask, some of the older physicians who have, when they started practicing, used a blade and now use this, they'll tell you that with the blade the cats were out for 3 to 4 days, and with this they're crawling on their cage and playing with their toys 2 hours after surgery.
Really?
Yeah.
And then they come back to you and then they're okay, like in a couple days? Totally okay?
Yeah, I mean, they're still healing. There's going to be some scabs there, so at 10 days until they're like good to go, but much less painful. It's a huge asset, and I think it's absolutely essential. If we're going to do this procedure, it needs to be done right, and this is one of the tools that we need to use to make sure it's done right. The other thing is making sure that we use multimodal pain medication, which means first making sure they have pain medication, and then using different types of pain management. So that's going to be, like a medication, maybe some of our companion laser after the surgery. after the surgery and the morning after, to again just further decrease inflammation, speed up healing, and those types of things.
What percentage of cats, indoor cats, do you think are declawed?
30 to 50 maybe.
Really?
Yeah. But if we decide to do it and we take all of those things into account, it's not nearly as, I wouldn't say it's any more painful than any other surgery that we do.
What about overweight cats?
That's another big problem.
This one here is very thin. I mean, it looks like...
He's perfect. He's not.
Oh, he's perfect because he
Yeah.
lives at the Conneaut Lake Vet Hospital.
Yes.
That's why
we
he's
measure
perfect.
his food every day.
Oh, Max, you have a tough life, I'm sure. So is it really
He gets
a problem?
lots of treats. It is,
Yeah, I'm sure.
it is a problem. It's just as big of a problem in cats as it is in dogs. We see a lot more of type 2 diabetes in cats. In dogs, we see a lot of type 1 diabetes. Type 2 diabetes is kind of the overweight, obese related diabetes. And so we see a fair amount of that in overweight cats. So it's kind of just a matter of time before that happens.
And how do you control that?
Insulin.
Really?
Injections.
Shots?
Yeah.
I can't give pills, let alone shots.
So
well, again,
yeah,
it's barn cats.
Doing insulin therapy for a barn cat, it would be quite a challenge.
Would be a challenge.
There are, in cats, sometimes we can get them to revert, and so they'll become non-diabetic. Sometimes we can do that. We change their diet regardless, but there's some special diets out there that sometimes we can use if it's a more mild case instead of insulin, and get them to revert that way.
What about dentals? Do we have to do dentals on a cat?
Yeah. Dental disease is also a huge problem in cats, just like dogs. Cats have a few special forms of dental disease where they get a lot of excessive inflammation of the mouth. Their gums just really react to the plaque and the tartar that's there, so that's kind of a difference. It's very, very painful. The cat might be, drooling, not want to eat, vocalize when it's eating. The other special thing that we see in cats is something called cervical lesions or neck lesions. And it's essentially a cavity-like lesion that's right at the gum line, which is the neck of the tooth, so that's where the name comes from. They're also very painful. They cause the tooth to reabsorb. Very, very painful for the cat. So Max actually had some of those, which is why he had a dental recently, to get those teeth out, because it's just so uncomfortable for them.
Is he missing teeth then?
He is missing teeth, yeah.
Max.
As far as just recognizing illness in cats, cats like to hide things. Some dogs, will hide disease, but cats really like to hide disease. If you think about it, they're predators. They're at the top of the food chain, so they don't want to show any weakness at all. So signs tend to be more subtle, and we often don't notice things until disease is very far progressed. So in that situation where things have progressed, they're going to be obviously sick, but you're going to say to yourself, she seemed fine for, the past 6 months.
Right.
And so sometimes people, beat themselves up, like, I can't believe excuse me, can't believe I didn't notice anything was wrong. I always say, it's not your fault. Cats, they just like to hide their illness. And so he or she didn't show you anything that would have tipped you off. The other thing that sometimes we'll see is subtle changes in their behavior or lifestyle. So whereas a dog, with arthritis might be limping after playing fetch, and you're like, oh my gosh, my dog's limping, you go to the vet, get it taken care of. A cat, instead of limping, they'll walk totally fine, but maybe they don't jump up to that windowsill that they used to sit in every day. Maybe they stop going up the stairs and just hang out downstairs all the time now. So it's more subtle things like that that we tend to see in cats.
We talked about cat bites as far as a human. Cats fight with one another a lot, and there are cat bites. They get an abscess?
Yeah. So an abscess is like a pocket of infection, basically. It's usually full of pus. It's really nasty and stinky. And that's essentially what would happen to a person if they didn't get medical attention, is that bacteria from the cat bite would, because it's a puncture wound, it gets kind of deeper in there, and then the body walls off the infection and tries to push it out. Usually we do surgery for those to open up that area of infection, put a drain in so the infection can get out, and then of course antibiotics and pain medication.
All that kind of stuff too. Is there anything else we haven't discussed? We discussed the wellness exam. We did do that
So
too.
for younger cats, like 6 years or less, we recommend an annual exam. For geriatric cats, so 6 to 8 years and older, we do recommend a twice-a-year exam. You can see our program on cat diseases that kind of encompasses all the things that we look for in our testing for with our regular blood work and things like that.
Okay, I think that's just about it. We would encourage everybody that if they like the information here, they could go to the on-demand Armstrong on demand, and they could find our presentation that we did there on cats. I think that's 2 sections long, as a matter of fact.
It's a two-part series.
Two-part.
I think we did a pretty extensive
We
section
sure did.
on a cat disease, and then we talked about training, so some of the information on pilling is on there in some more detail about how to train your cat to like the carrier, litter box questions, and all sorts of stuff like that.
I think that may, if it isn't there now, it should be on soon. I think it may also be available on YouTube, but I'm not sure. And Max, you were a star, and I really do like you.
Isn't he wonderful?
Oh my God, yes. And I'd love to have a cat in my house, but with 4 dogs, probably not a good decision. You see that Indianapolis 500 around my house. That's what it would be like. But it's very, very nice. Thank you very much,
You're
Dr.
welcome.
Consla. I really appreciate it. And
Max,
we enjoyed having you here also today. And again, check out other programs that are on Armstrong On Demand or also on YouTube. Thank you.